So hi everyone, welcome back to today's video, and in this video we will be discussing about positive predictive values and the likelihood ratios. Before we start with the predictive values and the likelihood ratio, let's discuss what is sensitivity and the specificity of the test just a little bit. So sensitivity asks that among people with the disease, how many would test positive? That means if you take 100 diseased individuals and 30 of them test positive with a particular test, so that means the sensitivity of the test is 30%. And similarly, if you take 100 people without the disease, healthy individuals, and 30 of them test negatives, that means the specificity of the test is 30%. So sensitivity and specificity are used to rule in or rule out the disease. They are the particular inherent characteristic of the test. Doesn't depend on prevalence. So the point take home here is that sensitivity and specificity do not change with the prevalence. It may be difficult to find 100 diseased individuals. It may be easier to find 100 healthy individuals depending on the disease prevalence. But sensitivity and specificity are the inherent characteristic of the test. It doesn't depend on the prevalence. So that is why sensitivity and specificity do not change with the prevalence. And we look down at the disease positive column to calculate sensitivity, and we look down at the disease negative column to calculate specificity. You can go back to my sensitivity and specificity video to go into the details and have some examples, but we will move to predictive values. So as we have discussed, sensitivity and specificity are the ability of the test to rule out or rule in the disease. It does not depend on prevalence. Remember this. Likelihood ratios also does not depend on prevalence. Okay. Sensitivity, specificity and likelihood ratio does not depend on prevalence. On the other hand, predictive values depend on prevalence. P for predictive value, P for prevalence. Remember this. It is very important to remember. So what is predictive value? If we compare that with sensitivity or specificity, what we have just discussed, what is predictive value? Predictive value flips the question. Predictive values ask that if the test is positive, in case of positive predictive value, if the test is positive, what is the probability of this patient having the disease? So that is what positive predictive value asks. If the test is positive, this whole population, if the test is positive, what is the probability of having the disease, these individuals? So what is the formula of positive predictive value? If we look at the definition, if the test is positive, what is the probability of having the disease? It is all the patients with the test positive are true positives plus false positives, and the numerator will be true positives. So this is the formula of the positive predictive value. True positives divided by true positives plus false positives. I hope this is clear. Negative predictive value is if the test is negative, what is the probability of not having the disease in this particular patient? So how do we calculate it? We will take as denominator all the test negative patients, this particular population or this particular cohort of patients, and we will see how many actually don't have the disease. So the numerator will be true negative. So how many of the patients actually don't have the disease, true negatives, divided by false negative plus true negatives. This is the negative predictive value. So remember this, for calculating positive predictive value or negative predictive value, you will look at the 2 by 2 table horizontally for predictive values. For sensitivity and specificity, you will look down at the 2 by 2 table vertically. Sensitivity and specificity. So that is what you have to remember. So till now, the important points we have discussed are that predictive value depend on prevalence, likelihood ratio do not depend on prevalence, specificity and sensitivity do not depend on prevalence. And for sensitivity and specificity, you will look down at the disease positive and disease negative column respectively, and for positive and negative predictive values, you will look at the 2 by 2 table horizontally. So now the question is, why positive predictive values or negative predictive values do not depend on prevalence? So what is the question when we discuss the positive predictive value is that what is the probability of the disease, of having the disease in a particular patient if the test is positive? So I have taken a scenario here. Suppose you conduct a test for the diagnosis of myocardial infarction or cardiovascular disease in two patients from two different populations. These populations, I will show you this population, and test comes out positive in both these patients. Now you will say that if the test is positive for myocardial infarction or cardiovascular disease in two patients, then the probability of having the disease should be equal in both these patients. So now let's look at the population. So this is population 1, this is population 2. Do you think the probability of having cardiovascular disease is same in both these patients if one patient is coming from this population and one patient is coming from this population? No. Why? Because this is an unhealthy population. So probability of having cardiovascular disease is more in the patient coming from this population, and it will be less if the patient is coming from this population. Although the test is positive for both these patients, but the test there are more chances of having this test as false positive in the patient coming from this population, and that there is more probability of this test being true positive if the patient is coming from this population. So that is why predictive value, the probability of having the disease if the test is positive depend on the prevalence, depend on the pre-test probability. So pre-test probability is a technical term, a statistical term for prevalence. We will discuss this again. So positive predictive value depends on the prevalence of the disease itself. Okay. So we have discussed positive and negative predictive values. So this is just a scenario. So predictive value depend on the pre-test probability or the prevalence. Okay. So predictive value depend on the pre-test probability of the disease in the population being tested. These are not the fixed characteristic of test, depend on prevalence. And sensitivity and specificity are fixed characteristic of the test, as we have discussed before. But they are not useful clinically at individual patient level. Remember, we have taken 100 healthy individuals, 100 diseased individuals to calculate the specificity and sensitivity respectively. So sensitivity and specificity are internal characteristic of test, but they are not useful at the individual patient level. So what should we do? What should we do with all this data, all this discussion if it is not relevant clinically? Here comes in the likelihood ratios. So what are likelihood ratios? How much does this test, if you conduct a particular test, result change the clinician's belief that this patient has the disease? So that is likelihood ratio. Likelihood ratio is that how much does a positive test change the belief of the clinician that this patient has a disease or this patient does not have a disease. That is a likelihood ratio. So they are very relevant clinically. Likelihood ratio tells us how many times more likely a test result is in a diseased person compared to a non-diseased person. So that is a likelihood ratio. So likelihood ratios combine the sensitivity and specificity of test to measure the clinical utility of test. Doesn't change with prevalence. What changes with prevalence? Predictive values. So clinicians love the likelihood ratios because they want to know how much it changes my belief that this particular positive test, how it changes my belief that a positive test changes the probability of having the disease in a particular patient. So positive likelihood ratios is that if the test is positive, how much more likely is the disease in the patient tested as compared to non-diseased, or how good a positive test at confirming the disease. Here we are talking at individual level. We are not talking about 100 patient or the percentage as we are doing in sensitivity and specificity. So how to calculate positive likelihood ratio? As we have seen in the definition, probability the test is positive in the diseased person divided by probability that the test is positive in the non-diseased person. So that is positive likelihood ratio. So if you see the numerator, probability that test is positive in a diseased individual, what is that? It is sensitivity. And probability the test is positive in a non-diseased person, it is 1 minus specificity. Because what is specificity? Specificity is the probability of test being negative in a non-diseased person. So if I change this to negative for the sake of discussion, This is nothing but specificity. But I want to know probability that test is positive in non-diseased person. So what I will take? 1 minus specificity. So I hope we are clear that how this formula is derived. So positive likelihood ratio is sensitivity divided by 1 minus specificity. So if positive likelihood ratio is greater than 10, this is a strong evidence to rule in the disease at the individual patient level. LR positive 5 to 10, moderate evidence. Again, this is the formula. So negative likelihood ratio, that if the test is negative, how much less likely is the disease in the patient tested as compared to disease. So probability that the test is negative in diseased persons divided by probability that the test is negative in non-diseased person. So what is the formula? Similarly, 1 minus sensitivity divided by specificity. So these are negative likelihood ratios. So if a negative likelihood ratio is less than 0.1, it is a strong evidence to rule out the disease at the individual patient level. LR negative 0.1 to 0.2, moderate evidence. Let's talk about pre-test versus post-test probability. So what are post-test odds and what are pre-test odds? So pre-test odds are before the test. What are the chances of this particular patient having the disease? So what are the chances of having the disease in this particular patient before we conduct a test? So that is pre-test odds. So if you think intuitively, on which factor it will depend? It will depend on prevalence. Okay, because the chances of having the disease in a particular patient depend on the prevalence of that disease in that particular population. So that is why pre-test. That is what pre-test odds is. What is post-test odds? It is nothing but positive predictive value. If you think intuitively, PPV. They are not equal, but they depend on these particular factors. So I am not saying that PPV is equal to prevalence multiplied by likelihood ratio. I am not saying this. I am just explaining you that what is the pre-test odds and what is the post-test odds. So likelihood ratio multiplied by pre-test odds, the chances of having the disease in a particular patient before we conduct the test, is equal to post-test odds. That is chances of having the disease after the test is conducted. So if the likelihood ratio, positive likelihood ratio is greater, then it will increase the post-test odds more. It will increase the PPV more. What is PPV? The probability that this patient actually have the disease. So are you getting it? So if I have a very high likelihood ratio, that means if the prevalence is low, even if the prevalence is low, I have a higher chance that patient actually have the disease after I conduct the test. So that is why likelihood ratios are more relevant clinically. I hope you understand this. Okay. So now little bit about predictive values and likelihood ratio. What are the main differences? What depends on prevalence? We have discussed it again and again. Predictive value depends on prevalence, but likelihood ratios doesn't depend on prevalence. Very, very important point, very high yield point. What uses sensitivity and specificity? Directly, likelihood ratio. So likelihood ratio combines sensitivity and specificity to measure the clinical utility of the test directly. PPVs, predictive values indirectly uses sensitivity and specificity. We don't want to go into much details. Question answered. Given the result, what is the disease probability? That is answered by predictive value. How much does the result change odds? That is answered by likelihood ratio. So I know this is confusing, but remember the language. They directly ask this. Population specific predictive value, because predictive value depends on prevalence. Likelihood ratios are not population specific because they doesn't depend on prevalence. Uses of Bayes theorem. Likelihood ratio uses Bayes theorem. What is Bayes theorem? This is Bayes theorem. This formula is derived from Bayes theorem. So if they ask you which metric is dependent on Bayes theorem, it is likelihood ratio. So that is from my end today, and thanks. If you like this video, please like, share and subscribe, and thank you.